Color vision is basically a disease of eye wherein the patient's ability to differentiate between different colors is decreased or sometimes completely absent. The severity of color vision may vary from very mild to total blindness. If the color blindness is partial or mild, it is very difficult for the patient to identify himself if he or she is colorblind. If he or she is totally colorblind, then sometimes they will be able to identify that they have such kind of problem. But for mild color blindness, it is very difficult for the patient to identify himself that he or she is colorblind. It is usually, and most of the time, it is diagnosed during routine eye examination. Basically, color blindness is divided into two major categories: inherited and acquired color blindness. Inherited color blindness is genetically determined. Genetically determined means the gene responsible for color vision is defective. The gene responsible for color vision is carried by X chromosome. If there is any defect in the gene which is responsible for color vision is defective, then the child or patient will have. The males are basically more responsible, more affected by color blindness rather than females, because the chromosome which carries the gene for color vision is X chromosome. So males are affected because if they have one defective X chromosome, they'll present with color blindness. Females if you have two X chromosomes. So if one is affected and one is not, the X chromosome which is not affected will compensate for the defective X chromosome. So it is more common in males rather than females. Then the other type of color blindness is acquired color blindness, which can occur because of any kind of retinal pathology, optic nerve pathology, or at the higher function brain level, like macular degeneration, diabetic retinopathy, optic neuropathies. These are some of the common causes of acquired color blindness. So it is basically divided into two. Then there are some medical terminologies wherein we call it as monochromapsia, dichromapsia, and trichromapsia. Monochromapsia means all the three. Basically, color blindness is for red, green, and blue wavelengths. So if all of these color visions are defective, then it is called monochromapsia. If it is defective for any one color, it is dichromapsia, and if it is defective for all three, it is trichromapsia. Mild color blindness goes unnoticed and it will be diagnosed by routine eye examination, proper eye examination. Total color blindness can be accidentally diagnosed when we ask a kid to separate the colors, and we give the kid or any person colored blocks, and we ask them to separate and they won't be able to separate it in different colors. Then it is accidentally diagnosed. Otherwise, it is kind of a symptomatic disease. There won't be any symptom for color blindness. The most common, there is a specific test for identifying color blindness, which is called Ishihara color vision test. This is the most authentic and widely used test for color blindness. The specificity, sensitivity of which is more than 98%, and specificity is more than 100%. So this is the most widely used test. It is a book which contains 38 plates, color vision plates. The plates are contain some numbers which are written in different colors, 2-3 colors. Illiterate persons, for literate patients, the plate contains some numbers. For illiterate patients, the plate contains some zigzag lines, and we ask the patient to trace those lines. So Ishihara color vision test is the test which is widely used, most commonly used for color vision test. For mild to moderate color vision defects, we have some specific glasses and contact lens which can help colorblind people to some extent. Glasses or contact lens which are made up of customized filters which basically help differentiate between different wavelengths of light. They alter the different wavelengths of light so that the color contrast is increased between two colors. So to some extent it can be helpful, not completely. But yes, to some extent it can be helpful. But then again, if a patient is wearing contact lens for color blindness, then they may have some kind of side effects like reduced vision, irritation, discomfort, foreign body sensation. So they need to weigh risk versus benefit if they are planning to use such kind of contact lens. For inherited color blindness, there is no treatment. For acquired color blindness, if it is because of advanced cataract, then removing cataract can cure color blindness. But if it is because of some retinal pathology, optic nerve pathology, or higher brain function defects, then it is not treatable. So basically, some of the acquired color vision defects are treatable, not all, and inherited color vision is not treatable. Mild color vision does not cause much interference with day-to-day activities, or if the patient is not able to identify one specific color, it does not affect the daily activities much. But if the patient is totally colorblind, then yes, definitely driving gets difficult. Then getting jobs in some specific sectors like railway jobs, jobs in factories where identifying signals is very important, some kind of purposes like painting and all. So mild color vision does not affect with day-to-day life, but severe color blindness or total color blindness can affect. Inherited color blindness, if we are aware of our family history, then avoiding consanguineous marriage can prevent color blindness in children, because if one parent is affected and the other is not, the chances of male child getting either child getting color blindness is just 50%. To some extent, it can be prevented if it is inherited color blindness by avoiding consanguineous marriages. For acquired color blindness, as I have already told you, it is because of diabetic retinopathy, glaucoma, macular pathologies. So, if we take care of those diseases, like appropriate control of diabetes can prevent diabetic retinopathy. Regular eye checkups help in identifying the optic nerve or brain lesions in the early stage before there is a lot of damage. So, acquired color blindness can be prevented to some extent. Males have relatively higher chances of developing color blindness rather than females. One in every 12 male is colorblind, and 1 in 200 females are colorblind. So there is huge difference between male and female inheritance of color blindness. The reason I have already told you, the gene responsible for color blindness is carried by X chromosome, and since males have just one X chromosome, females have two X chromosomes. So if a male gets one defective X chromosome, he develops or presents with the color blindness. While in females are usually the carriers. Carriers means if they have one defective chromosome and the other chromosome is normal, then the chromosome which is normal is kind of compensate for the defective gene. So although they will be carrier for color vision defect or color blindness, but it won't be presented in them, like it won't manifest in them. They'll not be color blind.